Namaskar friends, this is lecture 2 of module 10 of the stress management course and we are continuing with defense mechanisms as means to reduce stress. Let us see what we have in our package today. Today we are going to talk about 4 defense mechanisms which are known as avoidance, conversion, denial and identification. So, the first one is avoidance. Avoidance simply means we try to escape from unpleasant situations, thoughts or people whosoever act as a stressor for us. So, what happens that we may feel stressed due to presence of people, due to entering into one or the other situation or maybe in presence of some objects. So, the best way to avoid stress or reduce stress, to remove those particular stresses from our environment, and if we cannot remove them from the environment, we try to keep ourselves away from them. This is the basic idea of avoidance behavior. This particular avoidance behavior is clearly observed in people suffering from PTSD, that is post traumatic stress disorder, where trauma has occurred due to a particular stressor. So, what happens that in later life people are quite committed to avoid all those stressgenic situations which can trigger the feeling of anxiety again. The same happens in phobia and panic disorder also. In phobia, the feeling of a stress or anxiety is associated with a particular stimulus and the individual is so determined to avoid that stimulus that he or she simply refuses even to see the picture of that phobic stimulus or to talk about it. Complete avoidance is found. Similar things can be observed in individuals for a variety of social stressors as well. So, what happens? Suppose we have witnessed a very bad car crash. The witness, the person who suffers from the sight and the feeling, the overwhelming feeling of that car accident, watching people dying because of that, will simply avoid driving in future, or he can move to the next level and avoid traveling by car or by road from one city to the other, because on highways the number of accidents are many more as compared to what we find within the city due to the speed limit. Okay. So, we simply try to escape from the situation or we try to not enter to it at all, which is known as avoidance. This gives you a short term relief, but what happens that in the long term you put a lot of restraints over yourself that I do not want to do this, I do not want to do that, and you simply make a tight boundary around yourself, making a small comfort zone and avoiding a large number of social situations and activities which you are supposed to be a part of in your later life. So, emotional avoidance can be there, means I try to avoid or suppress the emotions which are unpleasant to me, which causes pain and agony to me. So, if I am feeling bad, I will simply try to avoid it by going out, having some kind of fun activity, doing some shopping or anything like that. Cognitive avoidance can be there. Oh, I just do not want to think about it. Okay, try to keep it away from my conscious mind. I can make myself busy and over busy with a number of activities simply in order to avoid a particular thought or idea which frequently comes to mind and cause me a lot of stress. Behavioral avoidance can be there where I start avoiding people or situations which are potentially stressful. This can lead to short term reduction of anxiety. If I do not interact with people I find difficult to interact with, if I do not enter into situations which are potentially stressful for me, if I engage myself in many other activities so that I have no time left to think about the actual problem of my life or to remember something bad which has happened to me, I am engaged in avoidance. This will be relieving for a moment, but of course not in the long run. Alternative could include problem focused coping, emotional expression, mindfulness training and acceptance of one's life events. Then comes the technique of conversion. Conversion means changing the form of a particular thing. So, what happens that when we are emotionally overwhelmed with feelings which are uncomfortable for us, which are negative for us, which are painful for us, we try to simply convert them in physical forms and it may result in conversion disorder. Conversion disorder means physical expression of psychological problems. These conversion disorders differ from psychosomatic illnesses. You know, we have been talking about psychosomatic illness a lot in our earlier lectures, and when I talked about them, I told you that whenever a person is exposed to chronic stress, it may activate the HPA axis or the sympathetic adrenal medulla axis, leading to changes in the physiology of the person. Therefore, he or she may develop problems like hypertension, hyperglycemia, coronary heart diseases, asthma, skin diseases and many more. Then how does conversion disorder differ from psychosomatic illness? There is a main difference. In conversion disorder you will find symptoms, but no reasonable biological basis for those symptoms. For example, I feel palpitations all the time. It causes me a lot of problem if I feel palpitation. But if I go through diagnostic testing through ECG, through echocardiograph or any other kind of advanced test, none of the dimensions or functions of my heart is going to be deranged. So, in report everything is alright, but I am suffering from the symptoms, intense symptoms. This is conversion disorder. And if somebody develops coronary heart disease due to chronic exposure to stressors and the person undergoes diagnostic tests, you will find changes in the physiology of that organ. You will find deranged markers in the blood reports, in the echocardiogram, or you can find the change in frequency in ECG records. That is the basic difference between conversion disorder and psychosomatic illness. Both are due to stress, but they are not the same. In conversion disorder, you can find symptoms mimicking to almost all kind of known health problems, that too without a reasonable physiological basis that can be detected through diagnostic testing. Got the point? I hope it is clear now. So, conversion disorders are also referred to as functional neurological symptom disorder, okay, and it manifests physical symptom without or clear physiological or injury related explanation. This is what I was explaining just now. So, there can be symptoms of paralysis, seizures, blindness, deafness or any other kind, okay, and again you will not be able to find any genuine basis for that. Treatment options for this kind of symptoms include cognitive behavior therapy or other form of psychotherapy which mostly focuses on catharsis, that is expression of the pent up negative emotions which are causing these kind of symptoms. But of course, here also you have to be very careful, because you cannot make the patient feel that the symptoms that he or she was feeling were actually were not emerging out of physiological basis. If you tell them this thing directly, if you try to convey this thing to them, it will be very damaging to their self esteem, and they try to make more and more arguments in favor of their symptoms. So, instead of communicating it directly, even in CBT and other kind of psychotherapies, these therapies are projected as an alternative treatment, that okay, if you are not feeling relief through traditional medications, come to us, this is an alternative type of healing mechanisms which can work better with you, or a combination of therapy and medicine will definitely work in your case. Okay. The next defense mechanism is denial. Denial means not accepting the reality. What I am feeling, what I am watching, what I have in my mind, I will rather say that no, no, I don't have such feelings, I don't have such thoughts, or this particular thing is not at all problematic for you, for me. Even if I am suffering so much, just in order to maintain my self esteem, in order to maintain my image in the eyes of other people, I may sometimes come up saying that no, no, this is something very obvious, this is something very minor, I am not at all stressed due to it, although I am. This is called the denial behavior. I am not ready to accept the reality, at least in front of others, and in extreme cases even in front of me. If I have certain thoughts which are highly unacceptable, if you go through the books of psychopathology, you will get to read certain cases where people have ideas which were very harmful to their near ones, to their relatives, and when they start realizing that they have this kind of ideas in their mind, it was highly damaging to their self esteem. So, what they started doing, that no, I do not have any kind of such thought, and they were so firm in this belief that they were successfully able to suppress these thoughts in their unconscious mind, which could reflect itself maybe in dreams or in some other forms. So, this is not a final solution to the problem that somebody has, but then definitely it gives them a temporary relief. So, uncomfortable realities are not easy to be accepted, and therefore, people start denying them. The consequences of denial can include delay of treatment and strained relationship, and in order to overcome denial, we must create a supportive environment and seek help which can console us, which can give us a confidence that it is okay, it can happen with anybody, it has happened with other people also. We are not the only one who suffer from this kind of problem, and the problem can be solved if appropriate steps are taken. The fourth defense mechanism is identification. Identification simply means adopting someone else's mannerism, someone else's identity in order to solve one's problems. Sometimes you may notice young children behaving in an elderly manner, talking like adults, behaving like adults, taking up their problems as adults do. This is known as identification. Most often children start mimicking the behavior of their parents, and this is very obvious because those are parents are the most easily accessible adult figures available to them, and somehow they become the role model of the child due to the great dependence of the child on his or her parents. So, identification or introjection means internalization of the value system, internalization of the feelings, which is shown by the significant adults. this identification can be useful, it can be harmful at the same time. Why is it useful? If I have learned some appropriate coping mechanisms, if I have learned appropriate social skills from my parents, I have internalized all these efficiencies and abilities, it can help me in a great way to solve the problems of my own life. At the same time, if I have learned or internalized inappropriate behaviors like anger, like hostility, like aggression, this is going to aggravate my problem instead of resolving it. Most often what happens that children learn aggression by observing their parents. What happens when I am not ready to listen to my parents start scolding. Instead of explaining the reason behind their commands, their instruction, their demands or their expectation, they simply orders me, that too in a very straightforward and a strict manner. And not only that, they sometimes threaten me that if you fail to comply with my demand, I am going to withdraw this facility of yours, or I am going to introduce this punishment. Or they may start screaming and shouting at me. So, this will induce a fear feeling and I am compelled to comply with their commands. What a useful trick. The takeaway lesson is, if the other people are not ready to listen to you, shout at them, show your aggression, show your anger. The other person will be taken aback and he or she will be ready to comply with your commands. That is why internalization, although this is a basic process of socialization, it happens in every society with everyone. There is no one who has not internalized the value system or the behavior or the way their parents think. One has to be careful in doing this internalization, because internalizing inappropriate social skills, social behaviors or the feelings and the behaviors of parents, teachers or any significant adult could be very harmful. Children learn smoking or consuming alcohol by observing their parents. Whenever the parents get, or especially the father is stressed, he starts smoking. So, gradually the child will also pick up that, okay, this is the way to reduce stress. So, next time if I am stressed, I must also do the same thing. It may improve the situation for me. So, internalization is not basically bad. This is an obvious process, natural process ingrained in the process of socialization. If a child does not internalize the value system, the norms, the social traditions and conventions, he or she will not be able to develop an identity which is similar to his or her own community, which belongs to his family traditions. But it has to be adopted with caution, with awareness. So, this particular defense mechanism can serve the function of coping by providing a sense of control and security and enhancing self-esteem by identifying with successful or powerful individuals. This was all for this lecture. Let us see what we have learned till now. We have learned about avoidance coping, which involves try to avoid the person, situation and object which is potentially stressful for oneself. While it may offer relief for the time being, it usually worsens the situation by drawing the boundaries tight. So, the person is not ready to come out of his comfort zone, and that zone is not very big. The more we avoid, the shorter the zone is. We also learn about the conversion mechanism, where we convert the psychological distress into physical symptoms. Earlier, this conversion disorder was known as hysteria. So, if you talk to your parents or people of older generations, they may sometimes use the term hysteria, or you might have read about this particular term in your books, or you might have watched some movie in which this term was used. So, this was the term used for conversion disorder only, where we can have almost any kind of physiological symptom without a reasonable biological basis for the same, and definitely it differs from the idea of psychosomatic illness. Then we talked about denial means we are not ready to accept the real emotions or social situation. We try to avoid the reality by denying it, refusing to accept it. And finally, identification, which is basically the internalization of a set of values from a significant adult available in our surroundings. This is a basic element of socialization process, but it must be taken care of that the child or any other individual must not internalize an inappropriate behavior, value or skill. That is all for this lecture. These are the references that you can go through for further reading. You can have a number of books from your library, any of them would be a good choice for you. Thank you very much for your kind attention. Thank you.